Now, a great news story today. There's a new hope for couples desperate to have children thanks to an IVF procedure that's helping women fall pregnant sooner and have healthier babies.
Getting pregnant isn't always easy. For some couples, it's a long, difficult and emotional journey. Some turn to IVF, the process used to conceive a child outside the body. But even then, the success rate per cycle is only 17%. But now there's a breakthrough for women who've gone through failed IVF cycles or repeated miscarriages.
Miscarriage is devastating for any couple, and when it happens multiple times, it's heartbreaking.
Aussie doctors are using a genetic screening test that allows them to pick the healthiest embryos before implanting them. They do a full chromosome count and eliminate any which might be faulty.
Any new technology that can save one woman to having to experience profound grief of a miscarriage is a huge step forward.
The procedure only started here in Australia a year ago. Since then, 15 women have given birth to healthy babies. So can all women benefit from this new technology? And what will it mean for IVF success rates?
Dr. Mark Bowman is Medical Director at Genea, the first Australian fertility clinic to use this technology. Mark, one of the hardest parts of IVF is the heartbreak of these continued failed attempts for women. Could this remove that emotional trauma and desperation that often goes along with IVF?
Well, it will certainly help a subset of our patients. For many women, in fact, the majority of couples now, IVF is a highly successful process. But then we have a small subset of people who go through multiple failed attempts or perhaps have repeated miscarriages or particularly are older, and this newer technology may be of particular value to them.
So this small subset you're talking about, what type of women would this be good for?
Well, we're generally talking about women, particularly as they're moving into their early 40s. And there is also, irrespective of age, a subset of women who, sadly, IVF or non-IVF, get pregnant but keep miscarrying, and they have similar difficulties.
Mark, this is obviously a great breakthrough, but isn't there a concern here this is only going to encourage women to wait longer before they have kids, which we know brings with it increased health risks?
Well, certainly not. I mean, the message that fertility specialists and units like ours try to get out there is that you can't rely on this technology as some kind of substitute for getting pregnant naturally, and you certainly can't rely on technologies like this simply because you're older. So, you know, sex remains a very good concept.
Wise words. Mate, how much is this going to cost?
Well, currently, many IVF patients are out of pocket in the region of around $3,000. This additional genetic testing technology adds about another $3,000 to their out-of-pocket expenses, and that's part of the reason why, if you're likely to conceive with good old-fashioned IVF where we just simply select the nicest looking embryo to put in and that's going to have a high chance of working, then clearly not everybody needs this technology.
Well, some promising news for a lot of women. Thanks for chatting to us tonight, Mark.
No problem, thank you.
That news for Optimum. Optimum is sitting at home rubbing hands together. We better take a break. We'll be back in a moment.